Smart ways to permanently lower your risk of heart disease. In the United States, heart disease is both the major cause of disability and the leading cause of death. Many factors in life habits can raise your risk for heart disease, some of which you cannot control, but most of which you can. Check out the key risk controls you can handle to reduce your risk disease. Welcome back, folks, to another edition of Sweetie Kiwi. I hope you are doing fantastic. I'm doing marvelous. If you're doing as fantastic as I am, go grab a cup of coffee or tea or let's roll. Today I want to talk to you about smart ways you can permanently lower your risk of heart disease. Now, how can you reduce your risk of heart disease? There are several things you can do. You can control your blood pressure, because as we all know, high blood pressure is a major risk for heart disease, right? And it is important to get your blood pressure checked regularly, at least once a year for most adults, and more often if you have high blood pressure, right? So you want to take steps, including lifestyle changes, to prevent or control high blood pressure. The next thing you can do is to keep your cholesterol and triglyceride levels under control, because high levels of cholesterol have the ability to clog your arteries and raise your risk of coronary artery disease and heart attack, right? So lifestyle changes and medicines, if needed, can lower your cholesterol. Now, triglycerides are another type of fat in the blood, and high levels of triglycerides may also raise the risk of coronary artery disease, especially in women. Now, folks, I just want to put a little disclaimer here that we're not providing medical advice in this show. We are a general information show. If you need to find more about your personal condition, I would strongly advise you to contact your healthcare specialist, all right? Your doctor or any other healthcare specialist. It's very important. Now, you can also reduce your risk of heart disease by staying at a healthy weight. It's very important, because we all know being overweight or having obesity can increase your risk for heart disease, right? And because when you're obese or overweight, you cannot control your weight, and that creates some metabolic dysfunctions in your body, right? Including high blood cholesterol and triglyceride levels, high blood pressure, and diabetes. All right, so eat a healthy diet. Try to put more fresh fruits, veggies, and whole grains. Try to limit saturated fats, foods high in sodium, that's salt, and added sugar. Right? It's very important. Get regular exercise. Exercise has multiple benefits. Multiple. And I'm not even talking about, losing weight. No. Exercise is great for your heart. It strengthens your heart and improves your circulation. Exercise also helps you lower cholesterol and blood pressure. Of course, also helps you maintain a healthy weight. I've said that before. So all of these things can lower ultimately your risk of heart disease. Another way you can reduce your risk of heart disease is by limiting alcohol consumption, because drinking too much alcohol too often can raise your blood pressure. You hear sometimes you go on websites and people talk about, I drink socially. What does socially means? Are you drinking one bottle of a liquor every week or what? So drinking too much alcohol it's just very bad for your blood pressure. All right. And of course, alcohol consumption also adds extra calories, which may cause weight gain. So a higher blood pressure and weight gain raise ultimately your risk of heart disease. All right. So now it's up to you to kind of see what kind of lifestyle changes you need to make, right? In terms of alcohol, you don't have to, people say sometimes that, you have to drink no more than 2 alcoholic drinks per day, and women should not have more than 1. But everybody's different, and everybody's metabolic constitution is different. And so again, here we're not providing medical advice. So it's up to you to talk to your doctor and see what kind of lifestyle and dietary changes can help you. All right. And this is how you can reduce your risk of heart disease. Again, control your blood pressure, keep your cholesterol and triglyceride levels under control, stay at a healthy weight, eat a diet that is healthy, get regular exercise, and limit alcohol. I'll be right back for more tips on how you can reduce your risk of heart disease. Don't go anywhere. Welcome back, folks, to another edition of Sweetie Kiwi. We're still continuing our conversation here. So, other tips to help you limit your risk of heart disease. Don't smoke. Right? We all know this. I mean, cigarette smoking raises your blood pressure and puts you at a higher risk for stroke or heart attack. We know that, right? Now, if you haven't smoked yet, please do not start. All right? If you do smoke, quitting today, right now, will lower your risk for heart disease. All right? So talk to your healthcare provider to see the best way for you to quit. Manage stress. Stress has been associated, according to research, stress has been associated with heart disease in many ways, right? It can raise your blood pressure. Extreme stress can be a trigger for a heart attack, right? And common ways of coping with stress, such as smoking, heavy drinking, overeating, are bad for your heart. I mean, we just did a nice show on emotional eating. You might want to double check that. It's just fantastic. It's replete, it's packed with info about how to avoid emotional eating, how to be healthy in the long run. So another tip that you need to do, another thing you need to implement to reduce your risk of heart disease is manage diabetes, right? Because if you have diabetes, you are at a double risk of diabetic heart disease, right? This is because ultimately high blood sugar from diabetes can damage your blood vessels and the nerves that control your heart and blood vessels. So it's really critical to get tested for diabetes, right? And if you have it, to keep it under control. All right. And the last tip here on how to manage your heart disease, your risk for heart disease, is to get enough sleep. Right? It's very important. If you don't get enough sleep, you are raising your risk of diabetes, obesity, high blood pressure, right? And those three things, obesity, blood pressure, and diabetes, can raise your risk for heart disease, right? Now, medical authorities and the FDA, the CDC rather, say that most adults need anywhere from 7 to 9 hours of sleep each night. Now, it really depends on you. Some people I have friends who are very good at sleeping 7 hours or 6 hours, and they're good. So you just need to make sure that you have good sleep habits, right? And the thing is that if you have some sleep problems, you want to contact your healthcare provider ASAP, right? Because this is very important. And there's one that is very key here when it comes to sleep problem, something called sleep apnea. That is very dangerous and can be fatal. So because it causes people to briefly stop breathing many times during sleep. So you just want to contact your doctor to make sure that you are able to suppress that apnea, because apnea interferes with your ability to get a good rest and can raise your risk of heart disease. All right, I'll be right back right after this. Don't go anywhere. Welcome back, folks, to another edition of Sweetie Kiwi. We're still continuing our conversation here. And if you love the clarity and quality of the content so far, please consider subscribing to our channel. We appreciate it. And specifically turn on the notification bell so you are notified whenever we release a new show. And comment below, share, and like it. Now, I gave you some tips on how to lower your risk of heart disease. But I want to stop and talk a little more about smoking, because even though I mentioned it like very quickly in the earlier segment, I want to dedicate an entire segment to it here, because smoking is a major risk factor for heart disease. So how do you quit? If you're able to quit smoking, you would have done 80% of the job already when it comes to lowering your risk for heart disease. So the health benefits of quitting smoking can help most of the major parts of your body, from your brain to your DNA. All right, this is according to the CDC, the Centers for Disease Prevention, Disease Control and Prevention. So here are a few tips to help you quit. Use free resources. You can actually call in a number 800 quit now, 800 QUIT Now, a toll-free service staffed by smoking cessation counselors in your state. And this is across the 50 states, everything across the union. Every state has that. So it doesn't matter where you are, as long as you call 800 Quit Now, they can help you. Or you can go to smokefree.gov to discover options, including quit smoking programs that are aimed at various sections of the population. They also have a segment in Spanish. Now, decide to quit smoking. You got to make the decision. This is where everything starts, right? You got to make that decision to say, you know what, from today on, I want to make up my mind and say, I really want to do it. All right. And after you decide that, you want to pick a quick date. Put it on your calendar, write it on the wall in your office, put it as a background, image on your computer. Put it whatever it is. Whatever you can put it, because you want to remind yourself that, listen, I am quitting on this specific day. You want to get rid of reminders of your smoking life. This is another thing, right? So you just want to throw everything from cigarettes and ashtrays from your home and office. You want to have your car clean and deodorized. All right. So you want to spend time in different places rather than in old haunts where there are other people smoking. That's what the thing. You want to ditch your friends who smoke. You can see them, but make sure you don't hang out with them too often and go to the same places where you used to smoke. You want to create substitute habits. This is very important. You want to replace the smoking with something else, right? There are a lot of nicotine substitution programs out there. So you might check the FDA. For instance, the FDA has a series of nicotine substitution programs that are validated. So go on the FDA website and www.fda.gov to get more on that. You can also exercise, right? Because just moving your body is a smart stress reliever with the added benefits of making you want to smoke less. All right. The only thing is, please make sure that your doctor is okay with that, and that that your medical condition, your medical history fits whatever exercise program you choose. You can also ask your doctor for help. When you want to quit smoking, ask your doctor. Maybe he or she has tips, has some medication or some alternative therapies that may help you quit smoking. Another thing you want to do is you want to remove smoking triggers. Right? You want to think about, for instance, some people like to smoke after meals. Some people like to smoke and they like to have a cigarette with their coffee and newspaper in the morning. So you want to shake up your routines. So for instance, if you used to have a cigarette with your coffee and newspaper in the morning, just change that with exercising in the morning, right? The thing here is that you also have to picture your smoking cessation motivations. What is really motivating you? What is driving you? Why you want to quit? You got to answer that question, right? You got to answer that question. So, the more you picture that, the more you visualize the goals, the more you see yourself having attained your goal, that will boost you more. You also want to tell family and friends, right? Because they can cheer you up, they can encourage you, they can try not to smoke around you, right? To avoid you being tempted, right? And the thing is, let's say this is even better. Let's say your partner also smokes. You can decide, both of you, to quit at the same time, so you can reinforce each other, right? Another thing you want to also think about is stop smoking aids. This is what I was talking about earlier. There are some that have been approved by the FDA, right? So those are nicotine replacements. I'm talking about gum, patches, or with medication to help you quit, right? So the thing here is very important. Now, please, we also did another show on vaping, electronic cigarettes. Electronic cigarettes is not a good option when it comes to quitting. It's not. You want to check that particular show we did. We have delved into the data and the research is showing that e-cigarettes, aka vaping, is not a good substitute for traditional smoking and does not help you quit. All right, I'll be right back right after this. Don't go anywhere. Welcome back, folks, to another edition of Sweetie Kiwi. We're in the last segment of today's show, and I just want to quickly say that there are some heart disease risk factors that you cannot change. You're just born with it, right? So for instance, your gender. So some risk factors may affect heart disease risk differently in women than in men, right? So as you can understand, for example, estrogen provides women some protection against heart disease, but diabetes, for example, raises the risk of heart disease more in women than in men. So the gender factor is just one thing you can't change. Your ethnicity, right? Certain groups have higher risk than others. Research has proven that African Americans are more likely than whites to have heart disease, while Hispanic Americans are less likely to have it, right? Some Asian groups, such as East Asians, have lower rates, but South Asians have higher rates. So it really depends on the ethnicity. Your family history. So you have a greater risk if you have a close family member who had heart disease at an earlier age. Your age also plays an important role. So your risk of heart disease increases as you get older. So men age 45 and older and women age 55 and older have a greater risk, right? Of course, if you're able to put some of the tips I gave you earlier, such as exercise or moving around, not being stressed, you can considerably lower your risk of heart disease. All right, here is a recap of today's show. So at first I talked to you about how you can reduce your risk of heart disease. I also explained to you why smoking is a major risk factor for heart disease and how to quit. And then I gave you some heart disease risk factors you cannot change, right? So this is about it today. I just want to close now by saying that some people notice that they gain weight while they quit smoking, right? So how can you avoid getting weight when you quit smoking? It's very important that you want to eat healthy. You want to exercise. Those two lifestyle habits will allow you to keep your weight or even lose weight. It's very important, right? So exercise more and eat healthy. All right, I will talk to you another time. And remember, until then, stay marvelous.